India, with the number of coronavirus cases rising in India, the government has now prepared a strategy to minimize the risk at hotspots or areas where there's a cluster of cases. The strategy involves early identification of cases, followed by cluster isolation and containment at a war footing to avoid community transfer of COVID-19 in such areas. According to cluster isolation plan, a 3-kilometer containment zone would be created around the house of a COVID-19 patient. All the residents in this 3-kilometer containment zone will be asked to remain indoors, and sanitization of the entire area would be carried out. Health workers will also conduct door-to-door health checks to identify anyone who may have contracted the disease. Such checks would be conducted daily to avoid any community transfer. In case there are more number of cases, the containment area would be extended accordingly. Health workers would also maintain a list of all residents in the area, follow up with active patients, monitor residents for any symptoms, and provide swift healthcare to anyone who might develop symptoms. Now, the government has prepared this strategy after certain cities in India has seen a rise in the number of cases. Financial capital Mumbai has 88 cases out of the 215 patients in Maharashtra. Pune has 40 confirmed coronavirus patients after 4 new cases were reported in the last 24 hours. 4 patients in Pune are said to be in a critical condition. Delhi has seen a spike of 23 cases in the last 24 hours, and the total number of cases in India's capital has now risen beyond 72. Even UP reported 19 new cases in the last 24 hours, taking the tally to 80. Noida and Meerut are coronavirus hotspots in UP. Noida has over 31 cases, and a factory in the city has been declared a cluster with a reported 20 cases after a foreign national visited the factory earlier. Meerut too reported 12 new cases. However, the state's principal health secretary maintained that there is no community spread so far. Bhilwara in Rajasthan is another hotspot of concern, as the district has reported 22 coronavirus cases. Kerala has over 202 cases, while Karnataka has reported over 83 cases. The process of identifying hotspots will be carried out in all districts where there is a cluster of cases. Earlier, the Indian government had dismissed reports saying that there was no decision yet on extending the 21-day quarantine period beyond 14th April. Now, a strict cluster isolation exercise will be carried out at hotspots to contain the spread of the pandemic in India.